A very good evening to all the listeners of Rehabilitation Science Group. Today we have a very renowned exercise specialist and an experienced physiotherapist with us, with a lot of experience in sports conditioning and exercise physiology and sports exercise. Dr. GD is with us, sharing his knowledge and information on blood flow restriction therapy. Dr. GD, we welcome you today for the first time on Rehabilitation Science Group.
Thank you so much for lovely welcome, sir. And I thank to you and Dr. Dharam Pandey, sir, for a wonderful opportunity to reach people with the new scope of practice. And I love to share the very basic and very essential information about the blood flow restriction training in clinical practice. So many of us knows bit of information about BFRT, but in BFRT is not the word that is known for clinical practice for in many practitioner area. So I would like to take this chance to reach them. So I can share now screen share.
Yes, sir, please.
It is visible, sir.
No, sir.
No? What?
Yes, sir.
Thank you. Is it okay, sir?
Yes, sir, right.
Okay. So I, Dr. G.D. Pratap, and I'm a strength and conditioning uh, instructor for physiotherapist. And I work with the Physio Needs Academy to reach physios with the new area of practice. So today we're going to introduce about the blood flow restriction training for physical therapy practice. So what is blood? Hello? Everything's fine? I, Dr. G.D. Pratap, and I'm a strength and conditioning instructor for. Now I'm going to introduce what is blood flow restriction training. In our physical therapy practice, we have a wide variety of instrumentation and equipment. In practice, we often call it as passive interventions. So far in India, active interventions are not so well known due to the various lack of awareness and our curriculum, so on. So, but it's a time for us to put all the effort to learn, research, and practice the active intervention like exercise prescription. Again, exercise prescription, if you see in a fitness world, many non-medicals are practicing to the end. I've been come across some gym trainers treating ACL, and so far they have no knowledge about the injury part and how to progress the exercises, but still they are doing. So why not physios? So that's my one of the biggest questions. So that's how we made our protocols and our course in curriculum, everything to target these areas. So when you see this picture, this is the one of the beautiful picture about the give orientation about the blood flow restriction training. So we can take the one example here. For an example, ACL injury. When the person having the ACL injury, we often go for the bed rest if the doctor says we no need surgery, especially partial tear of ACL. And recent research also supports complete tear also can undergo physical therapy and rehabilitation successfully. So what happened when you go for bed rest in acute phase of healing, you likely to lose the muscle mass, and that gives a lot of trouble. Even in if you compare the normal population or athletic group, this both having significant loss of muscle mass that slow down the rehabilitation process. So I take this example of two people here. The one is the uh, people who undergo blood flow restriction training, who just going for the conventional rehabilitation. So as you see in the left side, there is a normal progression. So of course you'll be going for the bed rest for a week at least. So what happened, you'll be losing the phase 1, phase 2, phase 3. We can separate the rehabilitation process into 3 phase. If it is in the sports or if it is in the normal population, still we will going for the 3 phase of rehabilitation: the acute and the intermittent phase and advanced phase of rehabilitation. Your exercise prescription, your intervention, everything will change according to the phase. So you can see in the first phase, your ideal goal is to prevent the muscle atrophy and reducing the impact of the immobilization. Otherwise we call it as deconditioning impacts. So what we do the muscle stimulator, we do range of motion exercises, isometrics in pain tolerance level. So still we it reduces the muscle mass due to the non-weight bearing, and your gravity is the very essential for the musculoskeletal health. So you're not using the gravity against the gravity of your limb, so of course you'll be losing your muscle mass. And in the phase 2, I mean intermittent phase, you try to maintain the muscle mass, you are not going to grow any muscle mass, because to grow the muscle mass you need to load the legs with the huge amount of load. So for an example, for the hypertrophy, you need to use the minimum 60 to 80 percentage of one arm. That is not possible in the intermittent phase. So you'll not lose the muscle mass by doing your all the other exercise using the 1 kg or 1.5 kg of weight cuffs, range of motion exercise. This all will try to maintain. But in a phase 3, you shall able to grow some muscle mass. But to reach the phase 3, it takes significant time and effort, and it's always painful process because of uh, the healing process and the other maturation process. So if you see when you use the blood flow restriction training protocols in the phase 1, instead of losing muscle you'll be maintaining, which is actually phase 2 thing which you are actually doing with the phase 1 by using the blood flow restriction training. This guy is having some kind of cuff in his leg and the proximal part of the his quadriceps. So by doing that, he's accumulating the blood flow. So he's literally creating the metabolic demand and doing the very light exercises. For an example, usually in acute rehab, we even don't do any exercise. Frequently, we'll be doing the blood flow occlusion. That itself has the huge role to reduces the muscle atrophy. In a phase 2, instead of assisted walking, he's already started walking without assistance. Why? Because he's not losing the much of muscle mass in the phase 1, so it is easy for him to walk in a phase 2. Phase 3 is again started the weight training. So the duration of the phase 1 to phase 3 is significantly reduced, and it's like a pushing the athlete towards their goal of going back to the game quickly. So that's how the blood flow restriction training having a good results. So let's see how it is possible. So as I want to say introduction, the APTA, if you go into the APTA website and type the blood flow restriction training, they clearly says, according to the APTA, blood flow restriction or blood flow occlusion therapy or training is a new scope of physical therapy practice. Why? Physiotherapist is the one who is having better knowledge about body physiology, exercise physiology, and who can actually implement this into the clinical practice. So it's our scope of practice. So, and it's one of the better practical tool to use it in the musculoskeletal and the other systemic disorders. So when I call it as other systematic disorders, for an example, hypertension, diabetes, this all now research is growing, but in musculoskeletal, we already having the very good research reports. So why we need to use this? The very important one in acute phase, we cannot use the typical 60 to 80 percentage of one arm load to improve the hypertrophy. So 60 to 80 percentage one arm is not that smaller. So if you want to get hypertrophy, you need to use, but it is not safer in acute rehabilitation. If you see already the ligaments are getting connected each other, they are not so strong bond. So you cannot load the limb with that huge amount of resistance. So you can use somewhere around 20 to 30 percentage of one arm, but that without BFRT will not make any changes. That's how I want to say BFRT using the low resisted exercises itself giving the better results. So let's look back to the history of blood flow restriction training. So thanks to Sato, is a Japanese doctor who invented this technique in a few decades back. In 1966, Dr. Sato was in the attending festival in his hometown, and where he was uh, doing the kneel sitting for a quite longer time. After sitting in the in religious function for this kind of position for a longer time, he could able to get the pump in the sense the venous accumulation. Even if you sit quite longer in kneel down position, you can feel actually lactic acid being built up and your blood flow is accumulating. So after a few days, he started getting the DOMS, delayed onset of muscle soreness, in his both leg. And he was like trying to correlate how come without doing exercise, I was getting the muscle soreness. Usually this guy knows that what is muscle soreness and how it happened. But without doing exercise, he was able to get the muscle soreness. Then he identified the significance of the blood flow accumulation. When you occlude the blood flow, actually you are trying to create the metabolic demand to the muscle, and that actually causes the soreness due to the lactic acid. So later on, he developed this technique to improve the muscle growth by experimenting tying the different kind of cuff on his extremities. And later on in US, it's been a very good practice with the BFRT, sophisticated instrumentation and new tools being developed for accuracy and implementing into the clinical practice. And usually in India also, many bodybuilders uses this technique, though they are using okay, not so accurately, but it's our time to teach the world and doing the research on this technique to implement further. So I want to tell why hypertrophy is very, very essential. People who do exercise, if they get hypertrophy, hypertrophy in the sense growing the muscle. Growing the muscle is not just a simple form of health. It also having high impact on the general health. People who have good muscle mass, they don't get hypertrophy. I mean, they don't get that easily sick. Studies are showing they have better immunity, they have better vascularity, they have lesser cardiovascular adverse effects, and very important is they have lesser impact of the aging or sarcopenia, balance related issues. So yeah, growing muscle and maintaining the muscle mass is the significant way to lead the healthy life. So how you get the what are the factors actually influence the hypertrophy? If you see, load against to the muscle tension, you need a healthy load amount of the load, or we call it as resistance, to grow the muscle. Actually, you need to break the muscle cells to replace the muscle cells with the new uh, strong muscle fiber, and that often comes from the load being controlled eccentrically. You have the concentric and eccentric. So by doing the concentric type of exercise, you are actually not going to grow your muscle. You need to do the eccentric type of activity where your muscle get tear, micro trauma, and your collagen synthesis and protein binding, and it makes the strong muscle fiber. And second, very important was the metabolic stress. In the sense, when you do exercise, after enough number of repetitions, for an example, if you do exercise with the 5 kg dumbbell, after reaching the 8, 9, 10 reps, you started feeling the burning sensation. This burning sensation comes from the metabolic waste called as lactic acid. Lactic acid is the metabolic waste from the anaerobic energy system. So that is very, very essential. When you accumulate the more amount of the lactic acid will stimulate the growth hormones and the other protein binding fibers. The next one is the extension, I mean, stretch load, which I already told you by eccentric load, and extension of muscle damage. How far your muscles are damaged by loading the by load, by the metabolic demand, this all influence. The next one is the hormonal support and adaptation. If you see, if you do strength training and you're getting the muscle mass. Not only you're getting the muscle mass, it improves your hormonal profile. Especially we have the anabolic hormones. One is the testosterone, you have the insulin growth factors, and you have the other non-steroidal hormonal support to grow the muscles. And adaptation. For an example, if I'm already into the training for a many years, if I quit, I'll be getting the reversibility. Again, when I go back to the gym, I get the quick hypertrophy because of a earlier exposure to the exercises. That we call it as muscle memory. Muscle memory in simply your metabolic adaptations and your centralized pattern of muscle recruitment, everything is already programmed. So that program is quite long lasting, so that's why the people get again muscle growth fast as possible. The next one is the genetic. Some people, whatever they do, they cannot grow the much muscles just because of their genetics. And some, they get really blessed with good genetic, they get very good strong shoulders and chest. So genetic has very strong influence. So let's again see about the physiology of BFRT. So what happened when you apply the blood flow restriction training? Strength training is the most effective form of exercise to improve musculoskeletal health through achieving the hypertrophy changes in the muscle. When you do strength training, you're not only improving the muscles health, you're also improving the strength of the tendons, ligaments, capsule, other soft tissues as well. So that's why the strength training reduces the injury occurrence in the athletes, because the high performance athletes are uh, blessed with incredible strong ligaments, so they can perform their activity in high velocity. To get adequate strength and hypertrophy, there is a strict protocols to be followed. That is somewhere around 60 to 80 percentage of 1 RM resistance you need to provide. For an example, if I can lift the 100 kg in a one rep, so somewhere around the 60 to 70 kg, I need to lift for the more than the 6 reps, 6 to 10 or 11, 12 reps for the 3 sets. So this is the ideal protocols for the hypertrophy. But this load is not at all usable for people who got injury, or elderly people, or women's, and other practical area. You cannot apply this simply. These people are weak, they are suffering from pain. For an example, tennis elbow, if you see, if a cricketer got the elbow pain, tennis elbow, so you they cannot do the strength training. If they do not do the strength training, they cannot perform their activity in that high level. So what you do, if you avoid the strength training because it's causing them pain, you're delaying them to back to their gym, of course they loses their performance as well. So in such scenario, using the blood flow restriction training with the light load, 20 to 30% on arm, definitely not gonna hurt them, but it still giving you the better results than the using the higher loads. So some evidence also suggests passive combined with the muscular stimulation can be applicable in very very hyperacute cases where even normal isometrics are not possible. So you just use the blood flow restriction training curves and using the muscle stimulator multiple times in a day, definitely worth to do. So what is the mechanism here? So when you actually accumulate the blood flow through the blood flow restriction training cups, you are actually reducing the blood flow. Okay, in your muscle we have the three different group of muscle fibers. One is the fast twitch and fatigable muscle fiber. This fast twitch fatigable is very sensitive towards the lactic acid. So if you are already reducing the blood flow to the muscle when you are doing the exercise, the reduction in the blood flow causes a lot of lactic acid accumulation. So the white muscle fibers are very very sensitive. What happened here, when you reduce the blood flow to them, they break down quicker. I already told you, when you break the muscle, you'll be going to make the muscle. So when all your white fibers are strength fibers broken down quicker, then definitely the growth of the white fibers will be higher. So if you grow the white fibers more than the red fibers, of course your strength will be improved. And second one, when you do exercise, actually you feel the pump venous congestion. Even without BFRT also you feel venous congestion. That is because of accumulation of venous blood inside the vessels of your muscles. So this actually when you this actually directly proportional to the muscle growth. How? Because when the muscles are congestion with the blood, that stimulate these statalized cells. Statalized cells are the daughter cells, we call them. After muscle breakdown, the new fiber will grow from the satellite cells. The satellite cell, you need to give them signal how big they need to grow. When already muscle accumulated with the blood, it causes the pump and like a mountain like structure inside the muscle, that gives the signal to the satellite cell to grow in same pattern. That's why you are getting the huge biceps and huge your muscle bulky feel. And this will be enhanced by the blood flow restriction training. Why? Because you are arresting the venous flow and you're arresting the arterial flow. So more of the blood will be accumulated, more than the normally you do without BFRT. So definitely it gives the signal to the satellite cell to grow in a greater amount. And occlusion of blood flow may promote the hypoxic stimuli to cardiovascular system, because you're arresting blood flow, you're reducing the blood flow. Your cardiovascular system thinks there is the occlusion. So whenever there is occlusion, you need nitric oxide. Nitric oxide is the nitrates in the blood. They actually very unstable in the blood. So what the significance of nitric oxide is, it dilate the blood vessels. Also it gives the good signal to the new blood vessel formation by stimulating the endothelial growth factors. So you are producing the more nitric oxide with the blood flow restriction training. So if you this nitric oxide also helps to improve the anabolic profile. More the blood, when you are having injury, you are if you produce the more nitric oxide, what will happen? You'll deliver more blood. More blood brings the more nutrients and collagens to deposit in the particular area to grow better. So an indirect effect of the nitric oxide, it reduces the blood flow, sorry, it reduces the blood pressure, it reduces the other metabolic conditions like diabetic neuropathy. In a yearly diabetic neuropathy, definitely this is the best thing to do. So activation of intracellular protein synthesis pathways and satellite cell activity and fiber recruitment during exercise, this all will be enhanced by the blood flow restriction training. So another one thing, like when your muscle become acidic environment is very essential for muscle to grow. So normally you have the pH level of blood somewhere around 7 plus, and when the muscle blood lactic acid, due to the lactic acid, your muscle become more acidic due to the accumulation of lactic acid and H ions. These both are the byproducts in the anaerobic energy system. So this irritate the muscle cells and the nerves. That's why you feel the burning sensation in the muscle. This signals the growth factors, like especially your growth hormones, insulin growth factors will be enhanced by this stimuli, and these both are the anabolic agents, so they grow the muscles. Training with blood flow restriction training produce more muscle damage, as the high intensity leads to satellite cell to activation and rebuilding of the muscle fiber using the protein synthesis mechanism. So I already told you GH and I mean growth hormone and insulin like growth factors is very essential here. And additionally, BFRT also promote the vascular health. So if you have the good vascularity, and you'll be able to recover from the injuries quicker, and you'll be having the greater potential to do sports activities as well. So that also enhanced by the BFRT. And recent study, very recent study, 2021, it's a yearly level of evidence, and that shows the men does exercise, lower limb exercise using the blood flow restriction training. It improves the testosterone response towards the exercise higher than the when they are doing without BFRT. That's one of the good thing to do. So this is why in its future, if for erectile dysfunction and other testosterone needed activities can be performed by the BFRT to enhance the men's health. So application is more uh, practically important. When it comes to the blood flow restriction training, the application of the cuff pressure is still under studying. We were using these somewhere between the 160 mmHg, which is like mercury pressure, which you do with the when you monitor the blood flow, I mean blood pressure, it's equal. Okay, we have in BFRT we have arterial occlusion pressure. That is something different, but different from the blood pressure. Atrial occlusion pressure, for an example, if I put 80 percentage, that means 80 percentage of atrial flow you are accumulating, 20 percentage of blood flow you are allowing. Your aim is here to reduces the atrial flow, not the accumulating the blood, I mean occluding the atrial flow completely. You cannot causes the cell death here. Your idea is to create the metabolic stress by reducing the blood flow, not occluding blood flow. So you'll be keeping up to 80 percentage of arterial flow, not the 90 or 100. The another thing is when you apply the curve pressure of atrial occlusion pressure of 60 to 80 percentage, that is equal to 90 plus percentage of the venous occluding pressure. Why? Because atrium carries the positive energy blood, means due to the ejection pressure of the heart, if you accumulate whatever you do, still some blood flow goes because of the positive force comes from the heart. But venous pressure is not unlikely having the positive pressure, it's a negative pressure due to the it affected by the gravity and your range of motion of the your leg muscle activity that pushes the blood out. So that is so if you apply the 80 percentage atrial occlusion pressure, that is equal to the 100 percentage or 90 plus percentage of the venous occluding pressure. So studies show used somewhere around the 60 to 80 percentage of atrial occlusion pressure. That is equal to somewhere around 160 to 240 in the lower limb, 120 to 130 systolic pressure of the upper limb. So for an example, if you use the BFRT for the upper limb, you'll be putting the pressure up to the 120 to 130. That is enough. If you use the lower limb, 160 to 240 mmHg pressure you need to put. That's what they mean. And still, if your client or patient is very sensitive towards the cuff pressure, you're always be ready to reduce. It's pressure selection is solely on the patient choice, not the therapist or third person choice. So they need to feel comfortable with the particular pressure. And also sometime after few reps or few sets, the pressure again will be added due to the muscle contraction, frequent muscle contraction and accumulation of blood. Additionally put a pressure on the blood vessels that create more pressure, so you can reduce this further. So very important is whenever you apply the pressure, try to avoid the neuropathic pain. If you accumulate the blood vessels strongly, it causes the hypoxia, and hypoxia causes a lot of pain in the extremity. Many of us, we would have experienced by doing assessing the blood pressure. When it goes 160 above, you feel horrible pain in the arm. That it should be avoided. And if you get the cold extremities and is severe ischemic pain, then that pressure is really higher. So very important is 40 to 80 percentage of atrial occlusion pressure. If your client is very new to the blood flow restriction training, even 40 percentage of the atrial occlusion pressure is sufficient. So equipments, we have the three different stages of equipments. The one is the occlusion cuffs using the pressure cogs, and this is commonly available in the market now, especially in US, UK. And this, by using this, you can actually accurately hit the arterial occlusion pressure. It has the inflatable cuff, and it has the pressure monitoring systems, and we have some valves with the tubes. When we already applied the pressure, we can remove it. And where make sure there is a two place to do the occlusion. One is in the, as I shown in the picture, above the thigh, the proximal portion of the quadriceps, only area you can apply the pressure. On the upper limb, above the biceps, just above the bulky portion of the biceps. There is no other area is possible to apply the pressure due to the uh, nerve exposures and the other bony prominence. And simple strap does the good job, especially non-clinical areas, like if you are practicing this on the sports persons. They do not have any harmful to them because they are ability individual. But when you are using in the clinical practice, it's always advisable to get the pressure gauge. And the very very sophisticated instrument is the Hotsuit device or personal training system. This is not available in India, and this automatically sends your arterial occlusion pressure, and when you apply, it is super accuracy in getting the results. And very important, even in my practice, I uses the handheld vascular Doppler, which is very very essential to read the blood flow. When you accumulate, sometimes patient might not tell, they or may not feel the pressure of the ischemia. So what you can do is you can actually do the mild Doppler test using this handheld Doppler. And if you're able to get the pulse after occluding the your atrium, and definitely that is okay. But if the sound is not created by the device, that means you're occluded completely, which need to be reversed. And as I told you, some very in hyperacute cases, you can use the passive or active assisted BFRT. That will be done with the muscle stimulator, and especially before weight bearing or after the ACL surgery, TKR, THR. In these areas, when the patients are having more pain, when even passive movements are not possible, you shall apply the BFRT with the uh, neuromuscular electrical stimulation to reduce the muscle wasting and deconditioning. Some the very very recent evidence also they are applicable for the musculoskeletal practice. And studies we use the BFRT completely passive application using exercise on the lower limb after the bed rest in the ICU. So these are the some of the protocols. The ideal application, 5 minutes cup, they will be applied using the 3 to 4 times a day. They do in hyperacute cases. So in BFRT also applicable in the some other conditions like diabetes and hypertension. As I told you already, in a yearly diabetic neuropathy, what happened here? Still, you are having the very good blood flow to your lower limb, and that can be confirmed with the colored Doppler test. And your idea is to prevent the further damage. So applying the blood flow restriction training in very early neuropathy cases, it can be reverted, and it can bring the good results due to the endothelial growth factor activity. I already explained these mechanisms. And in hypertension, again, due to the endothelial growth factor and improved nitric oxide profile, you will be getting the hypotensive effect, which is very very healthy. I should tell, like in a yearly hypertension, like when the patients are not exceeding their 160 mmHg of systolic blood pressure, definitely worth to try. We also currently doing some research on this particular topic, and it is so many safety concern still there. But in BFRT, the recent evidence shows it doesn't have any negative impact on cardiovascular system in when you apply in these individuals. And very 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 important here is the osteoporosis and fracture healing. So why osteoporosis comes, due to the hormonal changes, lack of hormones. So what happened when women's or other individual with the osteoporosis due to the aging, it's also directly proportional to their physical activity. So here, when you use the blood flow restriction training, as I told you already, it improves the pressure in the muscle. This pressure also additionally put compression over the bone. This compression additionally helps to form the stronger bones. It improves the osteoclast activities. If you see here, they used in this study, in very recent study, found effectively blood flow restriction training with the low intensity exercise like walking, mini squats, or climbing on the stairs. With the blood flow restriction training, post menopausal women with osteoporosis improve the bone health. And also, if you see the Wolff's law, what it says, like metabolic and mechanical stress both are important for the bone health. Metabolic stress, how you give metabolic stress? You can give them calcium pill or other thyroid, I mean other hormonal supports. But still, there is very important is you need a mechanical load by doing the exercise. And when you apply the blood flow restriction training with the exercise, this having the very good compressive effect of over the bone, and it forms the stronger bone. And again, as I told you, it also increases the growth hormone secretion and increased level of lactate HINs. This all collectively contribute to improve the collagen matrix activation, especially uh, cathepsin K and matrix, other metabolic calcium profiles will get improved this. So we are now to see about the indication and contraindication, especially contraindications. Contraindication is very essential to consider in PT practice. Here, absolute contraindications are hyperacute inflammation. So when you are having the injury, still you are bleeding inside the injury part, you cannot apply the blood flow restriction training. And if the inflammation is severe, you cannot apply the blood flow restriction training. And if the patients are susceptible to get the thrombus formation or TVT, you cannot accumulate the blood flow restriction training. And sensory loss, acute neuromuscular issues like poliomyelitis, NMJ issues, neuromuscular junction issues, myasthenia gravis, and these are the area you cannot apply the blood flow restriction training. And we often worry about the after using the blood flow restriction training, what about the clot formation? Study shows using the blood flow restriction training will not increases the risk of clot formation, so it's safe to use in the common population. And excessive muscle damage, as I told you, it damages the muscle. Sometimes excessive muscle damage can causes the renal failure, but not in the case of blood restriction training. So far studies are promising it don't affect muscle damage uh, that higher to get the renal failure. And exercise itself elevates the blood pressure. Of course, blood flow restriction training will hike the blood pressure a little further. That's why you need to check the blood flow, I mean blood pressure before applying the blood flow restriction training. But here, for an example, if the patients with the So for an example, if you're a patient with the cardiac failure and other vascular issues, you cannot apply BFRT techniques. Otherwise, healthy individual with the mild hypertension is okay to apply. So BFRT as an anti-aging, this is the new code. Like, BFRT improves the hormonal response towards the exercise, and it improves the bone health, it improves the vascular health, and new studies also focused on the improving the cognition with the BFRT due to the better nitric oxide. Nitric oxide is the one of the very essential thing to your body. When nitric oxide is higher, it improves the blood flow to the brain also. So better blood flow to the brain, it reduces the aging effect of the brain. It reduces the onset of dementia. So definitely BFRT is one of the best thing to do in geriatric cases. And sarcopenia prevention. If you prevent sarcopenia, of course, that means you are preventing the fall, you are improving the functional independence, and in future maybe it may should be studied for the improving the erectile dysfunction status. So definitely BFRT should be on anti-aging. So every physio is supposed to learn this and practice in their clinical practice. So What about the sports and performance with the BFRT? Short-term BFRT training would enhance the hypertrophy, strength, and general health of the athletes. However, it always should be mixed with conventional strength training and functional training for the central adaptation. When you do exercise, there is a two thing you'll get. One is the centralized adaptation, which happens inside the brain and the nervous system. The second one is the peripheral adaptation, that is your metabolic profile and your muscular health or musculoskeletal changes. So BFRT will not do much inside the brain. The central adaptation, it don't create much. Why? Because lesser load you are using. For central adaptation, you need a huge amount of load. BFRT actually target the peripheral adaptation. So using BFRT for in the sports, you should be very careful. You cannot avoid the conventional strength program. You always need to couple both, and especially in sports performance, if you see, if the athlete is in the late stages of rehabilitation, BFRT helps a lot to get back to the game. And most commonly used in swimming, cycling, throwing, football, these are the areas already athletes have started using it. So that's all about the little bit orientation about the blood flow restriction training. I would like to uh, give this opportunity, thankful for this opportunity, and also I'm ending up this session, and thank you.
Thank you so much, Dr. GD, for this wonderful insight on blood flow restriction training in not only in the athletic population, but also its application in general population,
Yes, sir.
as well as a scope of using it further to non-musculoskeletal problems as well. So it was very insightful. Thank you for being with us today.
Thank you.
Uh, and we hope that we will have more of you in the coming future.
Thank
Thank
you.
you so
Thank
much.
you.